Thank you for joining us today. My name is Jeff Graham. I'm the VP of U.S. Training and Education for Apollo Med Innovations. And this here is Dr. Michael Schreiber, who is our Medical Director. Well, today we're going to be doing a VistaPen procedure. Dr. Schreiber and I are both mic'd up, so we're going to be talking throughout the procedure. We have a room full of physicians here as well, so if they ask some questions throughout, we'll repeat the question for you. And then I'm going to show you the different techniques. We're going to go through the entire product line that we offer here at Apollo Med Innovations as it relates to microneedling and the benefits to these products as to why these should be a featured part of any protocol that you're doing as it relates to microneedling. So the first question we had was in relation to BLT, or what is the most effective way to use BLT cream, or what cream to use when doing microneedling. So,
for aesthetic procedures, what we found is that the BLT is a little bit more effective. There's still a predominance of 5% lidocaine in the community, and that's really not adequate for most of the cosmetic procedures. It requires it to be on about 30 to 60 minutes, which ties up a room, and also only works effectively if there's an occlusive, if you put saran wrap over it. The BLT takes about 10 to 15 minutes. You get good, adequate pain control, especially for microneedling, other micro-invasive procedures. The precaution that we do have is it needs to be removed completely before the microneedling. Microneedling increases the uptake of anything microneedled by about 80%. And lidocaine is a medication, so we have concerns about toxicity. So we always want to remove it totally before we start our procedure.
So our model has already been numbed for about 25 to 30 minutes. We've removed all the numbing. We have gone through the entire phase of getting her prepped and ready to go, and that does include doing an exfoliation of the skin and then using a nice gentle cleanser. So you're going to remove a lot of the dry, dead skin and then cleanse the remaining skin and get it prepped and ready to go for microneedling. So that being said, this is our microneedling device. This is the VistaPen. This is a device that will do 1,300 holes per second. It's got a depth gauge from 0 to 2.5 millimeters, and it's got a speed gauge as well, depending on what areas you're trying to treat or what modalities. So this is the needle cartridge that comes with the pen. These are your disposables. This is the disposable for microneedling. As well, we've got our back bar of HA. This is 100% hyaluronic acid. So this here is what you're going to use on the back bar for microneedling. Then we also have human epidermal growth factor. So a big influx that's come about throughout is the addition of growth factors or PRPs when doing microneedling. This is our human epidermal growth factor, and this is what really helps to present fibroblasts and help with collagen induction. Yes?
What patient factors determine the speed?
That's a great question. The question was, when to use different speeds. To get the most effect, we actually have 4 different speeds. We always tend to educate to just use the fastest speed. And the reason why is because multiple devices out there have multiple speeds. Had we had only one speed, a competing company easily can say, hey, we have 4 speeds, buy our pen. That's as simple as I can get it. So,
and also, in procedural sense, the slower the rotation, the more the patient feels it. So at higher speeds, it's a more painless procedure.
So there are 2 key factors to keep in mind when microneedling that create discomfort for the patient. That is a dull needle and a slow motor. So always keep that in mind when microneedling is you want the fastest pen on the fastest speed, and you want to make sure you're using a fresh needle every time. You're going to have some that want to use the same needle on the same client when they come back in a month, but these are 33 gauge needles, and when you finish a face, or face and neck, or what have you, these needles tend to get dull. And you want to make sure that you're not buying any kind of cheap counterfeit needles on the open market. You're going to get a lot of ads for, hey, we have needles for your microneedling device. The problem is those needles come batched out of China, and the cut on the stainless steel is a much different cut than you would get from the needles that are made for the VistaPen, which come out of South Korea.
There was a recent study that showed electron micrographs of the tips of some of these needles, and some of them were from companies that actually produce acupuncture needles. And what they showed was that many of them didn't even come to a point. They had a hook on the end of them, and there were flakes of metal. So the manufacturing is really not up to par, and you're leaving those particles in the face. And if it's not a straight in and out, you're actually ripping the face and causing more potential scar tissue. So having the reputable needle and not reusing is really an important part of skincare.
I'm going to run through our product line real quick so that you guys have an understanding of what these products are, what they do, and where to use them in your practice when doing a VistaPen procedure. The first piece is our vitamin C repair. And this is a product that you're going to use immediately post-procedure and or to send home with the patient. So what you're going to notice is the vitamin C repair is an excellent antioxidant that's used for post-care on the skin. So again, once you're finished microneedling, you've established thousands of microchannels in the skin. It is very important. It is crucial that whatever you're putting on the skin, as Dr. Schreiber said, 80% absorption. You really want to make sure that it's designed to not affect within the skin. So it's not a topical you're putting on. A lot of topicals that you may have on the counter at your house have the perfumes and have a lot of different unnecessary elements to them that you don't want getting down into the skin. They were designed more topically. One of our other products we have here is our Bio 5 Peptide Neuroextender. So this has 5 bioidentical peptides that are used, again, post-procedure. But one of the benefits of this product line is that it actually helps to prolong the effects of Botox when applied on the face. So Botox will generally last around 3 months. This can help extend that up to about 45 days. So we're finding that this is a heavily used product with our clientele. Over here, I mentioned earlier about the exfoliation. Here is our sensitive cleanser. Again, this is something that's going to be used after you exfoliate the skin to clean the skin and prepare it for the VistaPen. We also have our brightening veil. This is a key component. This has our hexaresorcinol as well as hydroquinone for helping lighten the skin. It basically inhibits the development of melanin in the skin. So it's a nice skin lightener for microneedling to help smooth the skin over. Then we have 2 post-procedure masks, and you're going to see all of this in the actual procedure. This is our cryo mask. Okay, this is a simple cooling mask. Once you're finished with a VistaPen procedure or a microneedling procedure, period, the face is hot. So when you have a nice cooling mask, or we have a growth factor infused mask as well. This is really what your patients are going to remember last. This is the final thing they remember when they walk out the door, was that cooling effect of the mask. This is what a lot of times will bring them back. So we're going to go ahead and get started. Do you guys have any questions up till now? Yep.
So what's the amount of time that a patient should wait before they are allowed to put on any makeup or any other kind of creams or anything like that?
We tell them 24 hours. However, we understand, I mean, I've had patients come in, we work on them, and they have a dinner party that evening, and they put on on makeup. But we don't generally like to have anybody put anything on until at least the next morning.
Ideally, the only thing that should be microneedled in is the stem cells or PRP. The only thing that should be put on topically immediately after is a high molecular weight hyaluronic acid. Sunblocks should not be put on. They should bring out a hat if you're in a sunny area. Sunblock should wait for the next day. Makeup should wait for the next day. Their regular regimen of skincare should wait for the next day, 24 hours, as Jeff said.
Another piece to keep in mind is avoid hot water. This is much like a sunburn. If you get a microneedling and then jump in the shower at the temperature that you normally use, the minute you put your head under there, it's just not comfortable. Yeah.
Oh, and you had asked earlier about contraindications. Pustular rosacea, you want to not do that. You can do it if it's nodular, but if they're having an eruption, you may want to wait for that to go down. You don't want to irritate it. On the other hand, it is very good on acne. They found it does reduce the bacteria count in doing that. So it's a relative contraindication. But people with rosacea, the heat can inflame them even more. So just have to exert some care.
So we're going to go ahead and get started. We have our needle cartridge here. We simply take the sterile pack out. We insert it into the pen. This is quite simple. I'm not going to spend a lot of time on that. Turn, unturn until it clicks. You've got a protective sheath here to cover the needles. And we're going to go ahead and add our sheath. This is a protective sheath to help for any cross-contamination. And what I mean by that is these cartridges are enclosed, so there's a separate chamber here that will prevent any type of topical ointment, HA, PRP, anything from getting down from within the needle. However, any external that comes down the side of the needle, that's the purpose for the sleeve. Now, if you're a clinician and you're doing this a lot, that's generally not a concern or not a problem, but it's something that we definitely provide for those that need it and want it.
What's the infection risk?
0.
Cross-contamination is a risk.
Right.
That's getting it on the gloves and handling the base, because these are not autoclavable. So you want to be concerned about that, using that, and just being cautious about holding it, wiping it down with a bacteriostatic cleanser.
Yeah, so we're just going to put this on and roll this over the protective sheath and then slide this over. There you have it. Once you've done that, the next phase is to take off this protective sheath here. Now we're set to go. Again, one of the techniques and what I've done is traveling throughout the country training on microneedling. I am not a medical doctor or a medical profession, but what I do is I see different techniques from all over the country. I've stolen every single good technique I've got and I've incorporated it into my talk track. And I will reference where I heard this, where I understood it, but most of what you're going to hear is techniques that I have picked up throughout my travels over the last 4 years throughout the country. One of which is with a corded pen, and you always want to use corded when you're doing microneedling. I will say the one advantage to battery powered is it's more convenient, but that's it. That's the only advantage that a battery powered pen has. Here's some examples. With a battery, as soon as you turn it on, it's a lithium battery. That's going to die. When your pen is running at 80%, that motor is going at 80%. Again, remember what we said about a slow needle or a dull needle or a slow motor. These are things to keep in mind. With a corded pen, you have nice, clean, consistent power all day, every day, and that's why any clinician out there, any office that's doing any remote amount of microneedling generally has a corded pen. So the cord is not an issue because the cord is never on the patient's face. As you can see here, I've put it behind my neck and then I clamp it down, either here, the back of your neck, it doesn't matter. But as you can see here, the cord is never an issue when I'm doing the procedure, okay? So, and that's key. A lot of people don't want to use a corded pen or have doubts because they think the cord is going to get in the way. Now, if I'd plugged it in right there and I'm microneedling here, I can see where that would be an issue. But there are, again, many techniques to avoid the cord coming into play at all. So what I do is, again, this was a technique that I've seen and I've found to be the most effective, is taking a tiny little cup and just filling it with several squirts of HA. Now, we're using human growth factor on her as well. And so what we're going to do is take a vial of our growth factor. And this is a 4 ml vial of human epidermal growth factor. That while 4 mLs, it's good for one use on the face or whatever area you're going to microneedle. However, because it's only 4 mLs, I often encourage to just mix in a couple of squirts of HA just to make it last a bit longer, to extend how far you're doing. So with a 4 ml vial of human growth factor, your treatment area is about the size of a piece of paper. So what happens is we're doing a full face and neck here. That's enough and that's ample for that. Should you have someone who's doing abs as well, or décolleté, or the whole many treatment areas, you're probably going to need more than one growth factor vial.
What's important to realize also is the HA molecule is too large to actually penetrate the skin. So it's acting primarily as a glide and at the end of the procedure as a sealant, as a film sealant. So it's allowing the actual stem cell, the secretly ageless, to be microneedled into the...
Now, as you're going to see, what I've done is dumped the 4 mLs into this cup and mixed it. It's going to mix with the HA. One of the things that's important is when you're done doing this, is to take your cap it, and leave it upside down. That will allow you to get the remaining about a 1 ml that'll just work its way down the side of the glass tube. So we're going to go ahead and get started. I've always taught and trained, start with the forehead and work your way down to the neck, and then of course continuing. A key area here is the biggest areas of patient discomfort come from the forehead and the upper lip. So I start with the forehead, and oftentimes it's a little bit discomfort, but then you're done. We're finished with the forehead. Now we move on. So we're on the downhill. We're almost done with. So what I'm going to do is actually perform it without the sheath so that I want you guys to be able to see as I'm changing the depth gauge to see where the proper depths are. There's no written rule as far as a certain depth for a certain area. However, what you're going to discover is that everyone's skin is different, and you're going to have some skin on people that they're thicker on one side than another because they drive to work every morning and the sun is beating down, and then when they drive home, it's on the other side. So you'll sometimes be doing 0.5 on this side and have to get to 1 on this side for the same result. So just keep that in mind, that not everybody is completely asymmetric on their skin depth.
And pain is also subjective, as you're going to see. So some people, even with numbing, are going to react. And you may have to just get them used to very shallow, and then as they get more used to the pattern, you can gradually increase from 0.25 to 0.5. The average skin thickness on the face, average, is about 1.5 millimeters. So when we're doing anti-aging microneedling, we're usually at 1 millimeter or less. Anything more than 1.5, you're actually down into the subcutaneous tissue. We may use that for medical microneedling, for scars or for deep dermis or tattoos, something that but for general rejuvenation, anti-aging, really staying below 1, because you run a risk of inducing collagen, scar collagen formation without really getting any benefit from being down into the sub-Q.
So you're going to see here, this is exactly ideally what you want the skin to look like when you're done with an area. So you've got your pinpoint bleeding here, and when you're running with the actual pen, you want to make sure the pen is following the contours of the face, okay?
How many passes can the skin tolerate?
Well, they could, multiple passes. So what I teach is 3 passes in several different directions. You'll notice here that, I'll start out and I'll be doing a diagonal like this, okay? And just getting this whole area. And you get to start to see, you want to analyze the areas that you've already done to kind of see exactly whether or not you're getting the reaction that you want. So you're going to notice my pen moves along the contours of the face.
And if you notice, he's not exerting a lot of downward pressure on the pen. He's really letting the weight of the pen.
You want to keep it flush. So turn your head.
That's what's really most important, turning the head, because if you're trying to go around, you can lift the edge of the microneedle and you'd be getting uneven cuts. So you can passively move the patient to a position you need.
Okay, so that's, again, the forehead is finished. And I always explain, okay, where the hardest part is over. Now we move on, we'll get our glabellar lines here, the 11s, the hot dog, however you want to call it. How you doing, Paige? Okay. Now we're going to slide down, and because most patients, when you do 0.5, let me just get an area here. 0.5 on the forehead oftentimes is 0.5 on the periorbitals, okay? So I immediately, without having to even change the depth of my pen, will go jump right down and start doing periorbitals. So I'll come down here and get just underneath the eye, and then I take my left hand and I stretch the skin.
You're really using that infraorbital ridge as your counterbalance, your counterpressure.
Now just keep in mind, set the expectations. If you do have clients that bruise easy, a lot of times you may get a little blood bruise or something right here. That'll subside within a few days, but just be cognizant that that's something that does happen in this particular area. Okay. Now I'm going to slide over and I'm going to do the other side. Again, this is so I don't have to change the depth of my pen. One less step, if you will.
You notice most of his movements are from the nose away. You want to do that moving from the cheek towards the nose predominantly leads to venous pulling, and you can end up with getting some bruising and some blood blisters. So you want to milk it away from the midline.
Now, once I'm done with periorbitals and forehead, generally what I've discovered is that crow's feet and then on down to the cheek, you're going to need to get up to at least 1.5 to get any kind of effect. Because of the squinting and the crow's feet, the skin is a little bit thicker. So I'm going to go ahead and dial up to 1. So blow your cheek out. Look at, yep. This is another technique I learned out in Arizona, is blow the cheek out. Makes it a lot smoother running the pen along there. Now this is a very common area for acne scarring, so you'd probably have to go even deeper in this area. Now you can see I'm making multiple passes in multiple directions.
With really deep acne scarring, you can also do subcision. And if you're familiar with subcision with a needle, in terms of even just going in deep and breaking up the fibers, then following up with microneedling to...
Now as you're going to see here, this is exactly the reaction that we're after, is that nice pinpoint bleeding. We've created a micro injury through all of these microchannels. Now what you're going to see is I haven't even gotten up around in here, and that's because of the zygomatic arch. I never try to go the whole way. So work this area and then this area, but don't try to do it all in one foul swoop. I'll come back, and you can always see where you've missed. And I'll be the first to admit, even as a proficient trainer who's been doing this for years, I've finished up and sometimes I forget to do someone's crow's feet or I forget a certain area. What you want to do is be able to look and see exactly where you need to touch up, or basically like building a house when you're going to punch out and finish up everything. So I always take an assessment of the final product when I'm done.
The old model, they're going through a kind of a paradigm change with thinking with this. And again, we're talking about anti-aging. It used to be like people would say, the question would be, well, if I have a patient with wrinkles, how deep do I have to go? The new question is, what cell am I treating? Am I treating the three main cells that we target in microneedling are the keratinocytes, which are epidermal cells, the melanocytes, which are down by the dermal epidermal border, and fibroblasts, which are down deeper. They're in the dermis. Microneedling improves the communication with those, but if you've got dry, flaky skin, that's a keratinocyte problem. So you don't need to go really deep. Melanocytes are down about 0.5, so your hyperpigmentation, you don't need to be really shallow. As a matter of fact, when going even deeper, when doing the 1.5 to 2, just for micro, I'm not talking about for scars or anything, just as a routine, you run a risk of creating heat, or because you're piercing through the melanocytes, you're creating heat, which can activate them, and you may even worsen microneedling. So, and the fibroblasts, we've for years been chasing the fibroblasts, thinking we needed to create an injury deep in order to stimulate the wound cascade. Now they're starting to find out that the keratinocytes themselves have the ability to stimulate collagen. They've even, there are studies that I've quoted in the PowerPoint that I had, where they found that they went down to 1.5 depth, but the collagen regeneration was only to the depth of 0.5 to 0.6. So even though they went deep, the deeper collagen didn't seem to be sensitive to microneedling. So the thing is, we may have been chasing the wrong cell. We've been doing the good work on our way down and not at the end point. So now there's a justification for most everything we can do at the dermal epidermal border. Wrinkles are considered to be a scar at the dermal epidermal border. It's the aging, it's the separation of the epidermis from the dermis that's forming a little disruption in the barrier. That's where, at 0.5, that's where that is effectively working. So the risk is, when you do the microneedling, you release a lot of growth factors, multiple growth factors. The problem is, a lot of those growth factors are fibrosis inducing. Some are non-fibrotic. All of the known non-fibrotic growth factors that get elaborated come from the keratinocytes. So a lot of the new research is saying we don't need to go so deep. As a matter of fact, going real deep routinely, you're maybe stimulating scar collagen, which looks good now because you got inflammation and you got edema. So the wrinkles gone away. But in 20 years, it's like a suntan. You look great now, but in 20 years, we see the damage that was done to the skin. And there's even thoughts that 20 years from now, when we see the end results of the deep microneedling, it may even consider negligence that we were microneedling routinely so deep because we're disrupting the barrier.
Now, for men that shave, or for women that have had a laser hair removal, what's the time span between when it's safe to do that versus shaving and hair removal?
In terms of the timing for doing microneedling and doing a laser hair removal or a laser procedure.
Or for men like me who have beards, but I may have some scarring, so I want to shave.
Scarring, you want to shave and do the microneedling work. You can do microneedling first. And typically we wait about 3 to 4 weeks to do procedures that are going to, the laser, HIFU, or RF procedures. So most thing, we go over that again tomorrow with in terms of the PDO threads also. It's a great question because in terms of packaging, when someone sits down and you say, okay, we're going to need microneedling, you're going to need laser, you're going to need some Kybella, we have to set up a time frame. And most of the time we're going to want to do the radio frequency or the at the front end. Because otherwise you have to wait 3 to 4 weeks to do that after a procedure. Yes?
How long after you shave can I come in and get the microneedling?
You can do that day.
Same day?
Yeah, same with laser hair removal. Actually, that's the best, is to shave and come in with it because you want as little stubble as possible.
You can shave the next day after you've had it. If you
Exactly, yeah, because the laser hones in on the hair, and if there's hair above the skin, even stubble, it's going to increase the risk of burn.
So we've completed her face, and what I'm going to do is, because we're going to be doing her face, neck, and chest, I'm going to go ahead and put the cooling mask on her face while we then go down and work on her neck and chest.
So if I shave and I'm starting to get kind of that ingrown hair, should I cut and pluck that out first before that, or should I just come and get the pen done?
I would probably remove the hair first.
Okay.
I don't think it matters. I think if you do the microneedling, it's going to assist in the healing of that. But you got a foreign body in there, and it's being broken down, so it's going to. As long as that hair is in there, it's going to create inflammation. Gotcha. And inflammation is the enemy of good healing. As you know, we're probably finding in medicine all the bad things are associated with inflammation, whether it's heart disease, cancer, arthritis. Inflammation is so. That's where in aesthetics, now we're looking at, are we creating a chronic inflammatory reaction with the things we're doing? And if so, why would we possibly do that? Every other organ system in the body doesn't respond well to inflammation. So that's where a lot of the shallow needling and the restriction of some of the chemistry that we use on the skin is coming from. It's in not only providing the nutrients that the skin needs and the cytokines and the stem cells to increase the communication, but it's also managing the inflammatory reaction.
Now, what I do is, upon completion, and you've put this growth factor mask on, this is a nice, soothing, cooling mask. I found that the most effective clinicians, and again, I picked this up when I was in California, is constantly have your fingers rubbing on the face when you have this mask on. This mask doesn't need to be on, but more than 5, 8, 10 minutes, okay? But if you put it on and don't do it, and then put it on and start touching, I've had clients actually say, keep your fingers on my face. They like this nice cooling, and you can feel the heat of the skin. Does this feel nice, Paige?
Mm-hmm, very.
Okay. These are soaked in growth factor, so these masks are infused with growth factor. So oftentimes, if you keep it like this, you can turn it over and see all that good growth factor? Oh yeah. Okay, so I'm going to leave that on, and we're going to move down here, and we're going to start to do her neck. Okay, so I'll have you look up. Now here's the center of her esophagus. I always stay on one side.
What's the risk of allergic reaction with any of these products? Have we had any?
HA, no. Stem cell, we haven't had any. I mean, they're using them in immune-compromised. Don't forget the origins of these were used for burn patients, mainly pediatric burn patients. So I'm not aware of anything on there that's caused any kind of immune reaction. You know, where they have had it with some of the, big problems with the products that have fragrances in them and excipients and other products that people react to. But this is a pretty well tolerated.
And for the patients that are immunocompromised, so there's patients who are HIV positive, Hep C positive, they've had chemo and their white cell counts are low. Any issues?
Would I do it?
My only concern with doing it is any of these procedures that are creating a wound, even if it's a minor wound, are drawing on the immune system to respond. To do that, it has to divert attention from fighting something else. That's my concern. Even when I'm dealing with someone, if somebody comes in with a cold and they want a pain, they want a study, I say wait, because if you're already fragile, if you're already borderline, and your immune system's working full time to fight off. Now, if they're stable, that's a different thing. Right. But if it's something where they're kind of, they're just kind of holding on, but they want to do something to feel better about themselves, I'm always concerned that I'm going to create enough draw on the immune system. They're either going to get sick or they're going to have a relapse or something. So I tend to be more conservative in that regard. Yeah, it's elective. But it is, because it's a regenerative procedure, it too draws on the immune system. That's all. If it were something like Botox, where it wasn't doing the immune system, it was just doing something, I'd probably have less concern.
Okay. And do you check for perhaps the Hep B?
Only in terms of the medical history. When I take a medical history, I want to know about any allergies to the cane medications. I want to know about dental, pain history. I want to know any infectious diseases. I want to know if they're prone to herpes infections. You may have to give them Valtrex as a preventative. I want to know about any bloodborne risks to me, HIV, Hep C, something like this. These aren't sterile procedures; they're clean procedures. But you've got the risk of aerosolized blood here. So if you have an at-risk population, you or your staff may want to be wearing glasses, and routinely that's not indicated, but if you have at-risk people, I would certainly wear a mask and because it's something we're doing every day. We have occupational exposure, and be very, very cautious. Some people even, they buy the long cords like we use for ultrasounds, the plastic sheath for the cords, just for those instances where you really worry about because the FDA, I have one of my slides which where the FDA lists as the risks for microneedling, and cross-contamination is one of them between patients. And Hep C and HIV was what they mentioned. So,
new needles for each patient, I'm guessing. So, how big of an area can one set of needles do? So, he's doing her face, neck, and chest. If he were now to add the abdomen, that would it be time to change that needle out, or?
What do you say? That's more of a manufacturer's question.
Yeah. He actually, he's moving forward right now, but if it wasn't Paige and he didn't know the patient, he probably would have changed as soon as he left the face.
Okay.
Yeah. Jeff's doing it this way. It's not, he knows it's a good needle and he's going to just move forward, but he's done Paige enough times to where he knows exactly what he's trying to get out of it.
And also the face is much more pain sensitive than is the neck or the chest. So you want to start, if you're going to stretch it that way, start with the face where it's the sharpest, because it's not going to be so pain sensitive down here with a dull needle.
So I take off the mask. Again, hydration is key, keeping the skin hydrated, because I've just created all these channels. So any leftover HA, I just rub it on, rub it in. It's getting absorbed. The absorption rate right now is extremely high. So
Do you put the mask on the neck and chest?
you can. I've seen that done as well. Now this is our cryo mask. So this is the mask. You grab that. So this is basically just a cooling mask. And so we take this. And these are nice because, does that feel nice?
Feels better than the other one, doesn't it, Paige?
I think I like the other one better. Am I supposed to?
Well, Jeff rubbed, that's Jeff rubbing. Yeah.
Yeah, probably, you're right.
I don't,
Hands are registered weapons.
He's not gonna
Yeah.
be rubbing, that's the reason why he likes.
yeah, I don't rub the cryo.
Must be great date conversation, Paige. Hey, Paige, what are you doing? Okay, so the reason why we don't put the same mask and stuff on the neck and chest.
You
is
could.
because-
It's just, well, what happens is it's round, so you could. But again, like he said, the chest and the neck it's a thicker skin. So I can really I can hammer when this burns, it's not a big deal. It's like when this does, it's an issue for comfort. So that's why this is. Now she can, and Paige, you're all set, thank you. She can sit up, and we have patients drive out of here with that mask on, and as a take-home kit, we give these to every patient. And what this is a lipid spray and then a silicone spray. So the lipids are basically what you want to do, what you want to put on here as well. These go home, and these will, let me back up. So the lipids are what you put on first, and then a silicone spray to kind of create a barrier for any exterior dirt and what have you when you go out. But the nice thing about this is that in a 4 to 6 treatment regimen, this will last the entire time. Patients don't need to buy this every single time. They take this, take it home, use it for 2 to 3 days post-procedure, and then set this in their medicine cabinet. So when they come back for the next procedure, they have this available, okay? So what I'm gonna do is I'm gonna actually put the lipids on her now on her chest. Okay, I'm gonna leave this on with her, but she has this at home already, so.
So you're really not wiping anything off in between any of these things?
You noticed the blood. When I'm doing this with blood, I'm rubbing that blood back in. Those are great stem cells, everything, that's good stuff. You don't ever want to take a cloth and wipe it off.
So this is your 4th of a planned 6? So.
And that concludes our microneedling training.